Hi everyone, I'm Yo and this is Virginia. Welcome to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So welcome to Canada. I'm actually in Ottawa by the Rideau River here. It's beautiful outside. So today I've got a great video for you and all my friends out there, hope you're watching, to clarify what exactly pelvic floor physiotherapy is and what exactly do we do. Just to clarify, because all my friends seem to think that we do this and it's all about the finger. And they go, hey, do you know what Yolanda does? She does this. And I'm going, that's not just what I do. So I wanted to bring this video to everybody to explain what pelvic floor physiotherapy is, because it's a very holistic approach to treatment. So stay tuned and let's get started. If you're new to the channel, please again, don't forget to hit that subscribe button, share with your friends to support our channel, and let's get started about explaining what we do as pelvic floor physiotherapists. Here's a quick video of what you would expect during a pelvic floor physiotherapy consult or exam, and of course, the accelerated censored version in my clinic. And hopefully this will make you feel more relaxed about what's involved with a pelvic floor physiotherapy consult. Hi, so nice to meet you. So I'm a little bit nervous about pelvic floor physio because I heard that you're going to do some work internally. So if you don't mind explaining what's going on with pelvic floor physio, that would be really great, because people say it's all about the finger and I'm not sure what that means. I totally understand. A lot of people come in here and they're not sure what's going on, so I'm going to explain everything to you so you're not apprehensive, okay? And that you can be as relaxed as possible and you can ask me questions anytime. And if you're not comfortable with anything, you can stop whenever you want to, okay? So just remember that you have full consent to what I'm doing and that it's your body. And if you're not comfortable, just let me know, okay? We'll work with what is comfortable for you. Just to explain the assessment, I'll be looking at things externally because everything's connected, as you know. So I'll be looking at, on the outside, of course, your posture, how you're moving, and your breathing and mechanics. That's really, really important. External work. So I'll be also feeling around here because you've got soft tissue, you've got myofascia, which is like connective tissue, and all this area here will affect your pelvic floor. So we'll be doing a lot of external work, so not just internal work. And this is Virginia. So we'll be looking at the outside in terms of your vulva to see if you have any problems here. You mentioned you have pain, so we'll be feeling here, okay? And then, of course, we'll be looking at things internally, and I'll explain to you what's involved with the internal assessment. Did you say you're going what? And I'll be looking at how you can squeeze the pelvic floor. When I'm going in, I'll be checking out for a prolapse. I'll get you to bear down. I'll be going on the inside, just see the muscles. What's your strength, your endurance? Do you have any pain? So this is a part where maybe your friends are saying about the fingers. So we are doing the internal exam with your finger. And this is where, again, this is where you might get the bug-eyed look like you see in this video part there. Ooh. Where some of my clients are a little bit surprised that it involves the rectal exam. And I didn't know that that was involved with it. Okay, well, that's interesting. And the reason why is because the muscles go all the way to the back, and especially if they have any kind of fecal incontinence or anything going out in the poopy area, or if you can't hold your gas or your poop, you really have to have that looked at. Gives you a more thorough exam, and of course, you want to see what's happening in the back. But of course, they have full consent of what goes on. So if they're not comfortable with that, we definitely work with what we have. Never had that before. Guess there's a first time for everything. But if it makes it more thorough, of course, I want to know what's going on, especially because I've had some leaking in that area too. That's fine. That would be helpful. And we can go as slow as you want and as much as you feel comfortable. And anytime you can ask me any questions. Hopefully that makes you feel a little bit more comfortable with what pelvic floor physiotherapy is, and it's not just about the finger or doing an internal exam. So please remember, if you have any issues in this area or even any back pain, hip pain, doesn't necessarily have to be just in the pelvic floor region, the lady part or men part area, because pelvic floor pain can also be mimicked as low back pain, hip pain, and of course, any kind of incontinence issues or prolapse. Please get it looked at, because pelvic floor physio is very effective in treating these conditions. And so you never know what a pelvic floor physio can do to help you to decrease these symptoms and look at your whole body so everything works together so it can optimize your pelvic, sexual, and overall health. So Virginia and I thank you so much for tuning in on this glorious day in Canada to learn about what we do as pelvic floor physiotherapists. So I hope that gives you a bit of clarity, and my friends too, you better be watching. This one's for you guys too. And I hope it makes you feel more comfortable with respect to seeing a pelvic floor physiotherapist. And you know, we can do just external work too, if that's what you prefer. And then if things don't change, then if you're more open to it, then they can proceed with some internal work when and if you're ready. Please comment in the section below and let me know what you think of these videos, and please subscribe and like to help support our channel. And please check out our other videos in the links above and throughout my channel. And Virginia, I look so forward to seeing you again soon.